আজ থেকে ৩০ বছর আগে সাধারণত হার্ট অ্যাটাক কিংবা হার্ট ডিজিজ শোনা যেত 60 ইয়ার্সের পরে, কিন্তু এখন দেখা যাচ্ছে 40 বছর, 35 বছর, ইভেন 25 বছর বয়সেও হার্ট অ্যাটাক নিয়ে আমাদের কাছে আসছে। এর জন্য ফাস্ট ফুড, আমাদের লাইফস্টাইল কিন্তু খুবই ইম্পর্টেন্ট। করোনারি আর্টারি ডিজিজটা হচ্ছে একটা লাইফস্টাইল ডিজিজ। লাইফস্টাইল ডিজিজ মানে এই ডিজিজটা আমাদের জীবনযাত্রা কিরকম তার উপর ডিপেন্ড করে।
There is a dramatic change in technology since 25 years. When I came to India for the first time and during the 90s, at this time we have only what we call the bare metal stent. It was just a metallic stent without any medications. And with this kind of stent at this time, the risk of repeat restenosis, what you call reblockage, was very high, between 30 and 40%. Then, from the beginning of 2002-2003, we have now that we call the drug-eluting stent. That means at the surface of this metallic stent, we have a medication to avoid the reblockage of the arterial wall. And nowadays, a lot of companies, and particularly the Indian companies, are making very good stent, with very good properties to go inside the coronary artery, and very good drug to avoid the reblockage inside the coronary artery. So this is probably one of the two major companies in India which are making these stents, which are very effective nowadays in terms of trackability, deliverability, and in terms of efficiency inside the coronary vessel. So definitely in India nowadays, first of all, the infrastructure, the facility are equivalent to the European and even the US standards, and the operators also have really improved their skills. They are now able to perform the angioplasty. Of course, we have young cardiologists, but we have also very young cardiologists in France who need more experience, but at the same age, at the same level, you have very good cardiologists able to perform a very good operation, very good intervention, very good angioplasty with very good device, very good stent coming from India.
আমার নাম ডক্টর সৌম্য পাত্র। আমি এখানে সিনিয়র কনসালটেন্ট ইন্টারভেনশনাল কার্ডিওলজিস্ট অ্যাটাচড উইথ মণিপাল হসপিটাল, স্পেশালি মুকুন্দপুর। আদার ব্রাঞ্চেস অলসো আই এম ডুইং সাম কেসেস। তো আজকে যেটা আমাদের কাজ ছিল সেটা একটা ওয়ার্কশপ ফর কমপ্লেক্স করোনারি ইন্টারভেনশন, কমপ্লেক্স করোনারি আর্টারি ইন্টারভেনশন। এবং আজকে আমরা যেটা করেছি, আমাদের যে ইন্ডিয়ান অরিজিনেটেড স্টেন্টসগুলো রয়েছে তার জন্য ডক্টর মার্ক এসেছেন, যে আমরা ওই স্টেন্টসগুলো দিয়ে আমাদের পেশেন্ট রয়েছে তাদেরকে কত ইজিলি আমরা এই কমপ্লেক্স কেসগুলো করতে পারি। সেই জন্যই আমরা আজকে একটা ওয়ার্কশপ অ্যারেঞ্জ করেছিলাম। অ্যান্ড ডক্টর মার্ক উনি এসেছেন একদম ফ্রান্স থেকে। এসে একটা কেস অলরেডি আমরা একসাথে করলাম, আবার আরেকটা কেস রয়েছে, এবং সেই কেসটা ডক্টর মার্ক আসছেন বলেই উনি অ্যাডমিট হয়েছেন, এবং আমরা একসাথে করব বলে নেক্সট কেসটা আমাদের রয়েছে। এইগুলো হচ্ছে শেয়ারিং আপ, হচ্ছে আমাদের এক্সপিরিয়েন্স, যে আমরা যা করছি আমরা ওনার কাছ থেকে নিলাম, এবং আমাদের ক্যাথ ল্যাব যেগুলো প্রপারলি ইকুইপড রয়েছে বিভিন্ন এই কমপ্লেক্স করোনারি ইন্টারভেনশনের জন্য, সেইগুলো দিয়ে আমরা পেশেন্টদের বেনিফিটের জন্য ওয়ার্কশপটা অ্যারেঞ্জ করেছি।
আজকে আমরা মণিপাল মুকুন্দপুরের তরফ থেকে একটা ওয়ার্কশপের অ্যারেঞ্জ করেছিলাম। এটা পিসিআই মানে পারকিউটেনিয়াস করোনারি ইন্টারভেনশনের ওয়ার্কশপ, পার্টিকুলারলি দ্য হাই রিস্ক প্রসিডিওর অ্যান্ড দ্য কমপ্লেক্স প্রসিডিওরের ওয়ার্কশপ। আমাদের এখানে এসছেন ডক্টর মার্ক সিলভাস্ট্রি। হি ইজ ফ্রম ফ্রান্স and he used to come in India several times since 1995 for different workshops. তো ডক্টর মার্ক এবং আমাদের এখানে যা ইনহাউস কার্ডিওলজিস্ট আছে তারা মিলে আমরা এখানে কতগুলো কমপ্লেক্স করোনারি ইন্টারভেনশন রেখেছি। তার মধ্যে ক্যালসিয়াম মডিফিকেশন অ্যান্ড ক্যালসিয়াম প্লাক মডিফিকেশন একটা ইম্পর্টেন্ট, যেটার জন্য বিভিন্ন রকম ইনস্ট্রুমেন্ট ইউজ হয়, যেমন রোটাবলেটার, অরবিটাল অ্যাথরেক্টমি, কিংবা আইভিএল বেলুন, যেটাকে বলা হয় লিথোট্রিপসি বেলুন দিয়ে আমরা প্লাক মডিফাই করে কিংবা ক্যালসিয়াম মডিফাই করে আমরা স্টেন্ট বসাতে পারি। করোনারি আর্টারি ডিজিজটা হচ্ছে একটা লাইফস্টাইল ডিজিজ মানে এই ডিজিজটা আমাদের জীবনযাত্রা কীরকম তার উপর ডিপেন্ড করে। এর সঙ্গে কিছুটা আমাদের জেনেটিক প্রিডিসপোজিশন, কিছুটা ফ্যামিলিয়াল প্রেডিলেকশন আছে। এই লাইফস্টাইল ডিজিজের একমাত্র প্রিভেনশন করার, লাইফস্টাইল ডিজিজের প্রকোপ কমানোর একমাত্র উপায় হচ্ছে লাইফস্টাইল মডিফিকেশন। এই লাইফস্টাইল মডিফিকেশনগুলোর মধ্যে হচ্ছে খাদ্যাভ্যাসের মান পরিবর্তন করা, হেলদি ডায়েট ফলো করা, ওয়েট কমানো, ওয়েট যদি বেশি থাকে ওয়েট কমানো, সুগার এবং প্রেশার থাকলে তার নিয়ন্ত্রণে রাখা, স্মোকিং হ্যাবিট বন্ধ করা, রেগুলার এক্সারসাইজ করা, এবং কোলেস্ট্রল বেশি থাকলে তার ট্রিটমেন্ট। আমাদের আজ থেকে 30 বছর আগে সাধারণত হার্ট অ্যাটাক কিংবা হার্ট ডিজিজ শোনা যেত 60 ইয়ার্সের পরে, কিন্তু এখন দেখা যাচ্ছে 40 বছর, 35 বছর, ইভেন 25 বছর বয়সেও হার্ট অ্যাটাক নিয়ে আমাদের কাছে আসছে। এর জন্য ফাস্ট ফুড, আমাদের লাইফস্টাইল কিন্তু খুবই ইম্পর্টেন্ট, মানে সেডেন্টারি লাইফস্টাইল।
Very grateful today that Dr. Mark he has come from France to attend this workshop, and
It's a pleasure to come back in India. Just to inform all of you, I used to come to India for 25 years. I came in India for the first time as a backpacker, and in 1999 I attended the first conference in Mumbai to do live cases in angioplasty. And at this time, it is true that there was a gap between Europe and USA and the rest of the world, because in Europe and particularly in France, we were among the pioneers to start angioplasty. And I've seen for 25 years that things have changed dramatically. And in India nowadays, you have very good centers. Like here, I've seen, first of all, the facilities have changed in the right way. You have very good equipment, very good cath lab, which is the basis to see the coronary arteries and to work in good conditions. And I've seen also the operators, the young cardiologists, the young generation, increasing their skills and working with the same standard that we use. And I can even tell you that some facility and some hospital in India are like a palace, and comparing to the hospital we have in France. Sometimes the facilities are even much better than in my own center. So I want to congratulate all of you, first of all, for this improvement of the facility, and all the cardiologists now in India, they have attended a major conference all over the world, and they know how to treat the patient. They know all the recommendations, they know all the tips and tricks. Some centers have younger cardiologists, and they also teach each other. This is what we were discussing this morning with the other cardiologists. The role of an old cardiologist and like me is to give the knowledge, give the tips and tricks to the young cardiologists. So it's my goal to be here today to share with them my experience, but I can tell you that they have also already the majority of the skills. I've just done more cases than them because I'm older than them, but they have very good equipment and very good skills as well. So we have done already one very complex cases. It looks simply from the beginning, but we know that even a simple case, when we touch the heart, it can become very complex, and so we have to manage how to treat the complication. If we have complication, we have to know how to change the hardware to use the right one to get a good result at the end of the procedure. So along the case, we discuss all together which catheter we might use, which guide wire we have to use, which stent we have to use, and this is how we improve our skills each other. Because the incidence of the heart disease and coronary disease is much younger in India. Probably because of many factors, history, family history sometimes, maybe the stress of life, the food habits. Also the Indian food is very, very nice. I like Indian food, but the Indian food is a little bit fat and sweet also. So the way we used to say that you are what you eat sometimes. So the incidence of coronary disease is younger in India compared to Europe. The average in Europe is around 60, 65, whereas it is around 50 in India. And they have much younger cardiologists also for acute situation, myocardial infarction, and acute coronary syndromes, what we call acute coronary syndromes. Sometimes you have patients of 25, 30 years old that we don't see very, very often in Europe. And in India also the incidence of diabetes is also much more important, around 40% versus 20-25% in Europe. This is an important factor to have a more coronary disease. So all those risk factor, what we call risk factor for coronary disease, are very important. So we have to First of all, to tell the patient to stop smoking, to try to exercise, to reduce the cholesterol, and to treat their diabetes when they are diabetes, and to detect the coronary disease by treadmill test, CT scan, and all the tests that we have to detect the disease when they are not symptomatic. Concerning the tools and the equipment, as I said previously, the majority of the cities all over India, I've been in many districts all over India, and I've seen a lot of centers very well equipped, with good facilities, very nice and up-to-date cath lab, and also the majority of the hardware which is available in Europe is nowadays available also in India. And I must even tell you that you have probably one of the best stent of the world, which is manufactured in India, that I use in my center every day from Indian company. So now this stent is available in France, and the health authority has given the reimbursement of this Indian stent in France since 3 years, and I'm using this stent routinely because it's very efficient, very trackable. It can go very easily in the coronary artery, and the results are similar than the results published by the previous American stent, which were the gold standard for more than 25 years nowadays. So all the new stents are coming mainly from Asia nowadays, and mainly from India. You have 2-3 big companies in India which make very good stents. So don't keep in mind that the best treatment are coming from US or from Europe. You have also in India nowadays very good treatment and very good devices to be used for the patients. The press is there. If you have a message to deliver to the patient, to your readers or to your spectators, is that the incidence of coronary disease is very important, is the first in terms of mortality in a lot of countries, and particularly in India. So if I have the message to deliver to the patient is not to neglect the symptoms. I mean, when you have any chest pain or if you have some difficulty to breathe, it's very important to have a consultation with the doctor. Not those symptoms must be neglected, never, because you can have a cardiac arrest, and a few days later you can have a myocardial infarction. So the first important thing is to go to see a doctor or a cardiologist to do a simple EKG. Electrocardiogram can give a lot of information, and then the cardiologist will take care of the patient and will do the tests which are important. So if you are around 50, 60 years old, if you have diabetes, if you have hypertension, if you have high cholesterol or family history of coronary disease, tell your readers or your spectators to have a consultation as soon as possible to prevent major adverse cardiac event like myocardial infarction or sudden death. That's very important to prevent all that.
Is to us. So from 1995 to 1999, when India had very few centers of angioplasty, sir used to come to India to proctor cases and to teach our seniors how to do angioplasty. So the story is far long, and it goes long back. And we are lucky to have him here, and we in our a case in Manipal Medica and now here and the Manipal Mukundapur. We were just discussing why our patients have smaller vessels, thinner vessels, and the kind of angioplasty is difficult in Indian patients rather than European US patients. So lifestyle is the key. I will not go further because the excellence which we are getting because of infrastructure. So the operator will work only when infrastructure is there, when we have tools to deliver things, and you can utilize them, and I'm very happy. And also about Indian manufacturers, stents and kind of valves. We have wonderful device makers, and Dr. Mark himself appreciates that the Indian stent is kind of outperforming other stents in the ease of deliverability and their long-term performance.
and having exchange of knowledge between us and the friends what they are doing. So coronary artery disease is a well-known disease, and it's very common now in India. Even the younger population, as you told, that it's almost 15 to 20 years younger generation are affected by CAD in India than in Europe, in Asia particularly. One aspect of coronary artery disease is the coronary artery calcium, which sometimes the disease process and the procedure, angioplasty procedure, becomes complicated because of the presence of calcium. And how to tackle calcium? Previously, we have only one device, which is known as rotablator device, and nowadays we have other devices are there, known as orbital atherectomy and IVL balloon, intravascular lithotripsy balloon also available to tackle the coronary calcium, so that stent placement can become easy and the long-term outcome is also good. So in this workshop we are having plan to use lithotripsy and the IVL balloon also in further cases which have a good load of coronary calcium. And all you know that coronary artery disease is a lifestyle disease, and it is part of a generalized disease known as ASCVD, that is atherosclerotic cardiovascular disease. So these to prevent the morbidity and mortality related to this disease is the lifestyle modification and lifestyle modification. There are some genetic predisposition is there. Some genetic population are more prone to develop this ASCVD, but lifestyle modification can only prevent or can only delay the presentation of the disease, and our future generation can be saved only with the lifestyle modification. And the lifestyle modification, as Mark told, that dietary control, reduction of weight, cessation of smoking, moderation of alcohol use, regular control of blood pressure, blood sugar, and cholesterol.
Dr. Masker, so it's a very pleasure to see him come all the way from France and to watch him live. It's a different thing to see him on stage in conferences and to see him in live. Angioplasty is now like a 20 years, 30 year process. It was started 20, 30 years back, but even today, when he was doing cases, we got to learn so many fine points that I think I will cherish it forever, and maybe it is a continuous process of learning. And as rightly pointed out by Dr. Masker, that symptoms of cardiac disease should not be ignored. So along with that, very important point is that patients should reach hospital in time. We have a very good unit, we have a very excellent tools, we have all the things, but like if then the patient reaches here, we make sure that if a patient is coming with a heart attack and it is like less than 6 hour duration, we label it as primary. So our center's focus is on primary PCI. We have seen that the maximum benefit of angioplasty is the patients who are coming for primary PCI, and our center is routinely achieving those balloon to door to balloon time, which was previously not as first medical contact to device, but door to balloon time of less than 90 minutes. So our center is routinely achieving those times, and along with that, we are doing angioplasty through radial route. And as Dr. Uttam Kumar Saha sir is sitting here, he is the pioneer of radial angiography in Kolkata. Like, if I'm not wrong, correct me, but he started first time for radial angiography and angioplasty in here. And I must admit that I learned the nuances of radial angiography and angioplasty from Uttam Kumar Saha sir. So you see, the knowledge is trickling down from Mark sir to Saha sir, then to us. So it's a continuous process, and we have a very good team here.